So yeah, thanks a lot for MHI core team to for organizing this. It's a pleasure being here and discussing about COVID-19 and misinformation and the infodemic. The way I've designed this, it's more as a talk rather than a presentation of data and research. It's something that I'd like it to be interactive. So if some of you have heard some myths about COVID-19, and I'm sure many of you have heard it, you can just drop it in the comments, and then I can talk about some of them. If there's anything else that you need highlighted throughout the talk, you can just drop it in the comments as well, and I can discuss it more. So let us look at what is misinformation, and let's start with the basics. So misinformation is spreading data that is inaccurate, something that is false, that has no scientific basis behind it. We'll further on see the different types of misinformation, but generally it's something that has no scientific basis. It could have an element of truth, but normally it is just a bunch of made up stuff that has no scientific evidence. Was misinformation there before COVID-19? Yes. And this is something that our research is looking at, that we always had misinformation and inaccurate information and data going around before COVID-19. So there was rumors that 5G causes cancer. There was rumor that mobile phones cause cancer. None of these are substantiated, of course. You have miracle cures and herbal cures going on for cancer and various other topics are going on before COVID-19. But when COVID-19 came as a pandemic, everyone who was making up conspiracy theories started focusing on COVID-19 and capitalizing on the fear and panic. And so this is something to understand, that it's not that misinformation started because of COVID-19. No, rather it became more rampant. The impact and adverse effects of misinformation are huge. So there's scientific studies that look and found that the media influences people's behavior and how they actually continue with their daily lives. So there was a study done in Australia in 2010 that found out that a celebrity who was diagnosed with breast cancer advised everyone publicly to do self examinations, and in that proceeding 3 to 4 months, what happened is that the number of self-referenced mammograms increased. At the same time, there are various studies that have seen that inaccurate information seems to spread faster than accurate information. A study looked at the various inaccuracies and claims that cannabis cures cancer, and they found that tweets talking about cannabis cures cancer spread 200 times faster and had a wider reach on social media compared to tweets that were looking at and that were debunking this inaccuracy. So we do know that inaccuracies spread faster, and there is different types of misinformation out there, and some of them can be deadly. The famous one is the one that was propagated by the President of the United States, saying that drinking or using bleach may have a benefit, or people should look into injecting it, and it has led to some deaths in the United States. Similarly, and this is just anecdotally, I've heard from colleagues in India who found that Trump's claims about hydroxychloroquine has actually increased the demand for the drug over there. And there are those who actually take it and distribute it to the public for that reason, only just because they think Trump said it and it's right. So we know that media influences behavior, and that there is a side effect, an adverse effect to it in people's lives and behaviors. So now we look at how does a misinformation spread. So there's two main ways that misinformation spreads. The first is by those who are propagating it, those who actually create the misinformation, those who actually come up with these theories and conspiracies. And then there are those who share it. And I think when we look at misinformation, we have to understand the two different levels that it spreads. Those who propagate it mostly have a cynical view about things. They have some sort of benefit, which we will look at later. And they might have some sort of incentive attached to propagating and creating misinformation. For some of them, it's just a worldview and how they look at things. Among those who share it, And this is where many of us would have to be tackling our efforts if you ever plan to address misinformation. Is among those who share it, you will notice that there is two ways. One is that somebody forwards as received or shares things unknowingly. And oftentimes you would see that when somebody receives anything, whether it's a post or a WhatsApp message or an Instagram or Facebook, normally the mindset that we have found that people think about is, oh, how do I share this? Or who will this benefit? Rather than thinking, is this accurate? So the mindset and the framework is, who will this benefit? Who else should I send it to? Maybe I should send it to Muhammad Zahir or Zain because it might benefit them. Instead of thinking, is this accurate first and then do I share it? And this is the mindset and framework that we have to change. And there are various psychologists that we are working with currently who are looking at this whole aspect and seeing how better we can manage it. Now, the other important bit is to look at who benefits from misinformation. So there are different types of misinformations, and we'll outline them one by one. So something like the breath test, about the breath test for COVID-19, where they say, hold your breath for 10 minutes, and if you don't, for 10 seconds, and if you don't cough, then you don't have COVID-19, which is obviously false. That type of misinformation, you can't directly see who's benefiting from it, right? It might have been spread by someone who took this type of initiative by looking at what's happening in a spirometric test and then sort of changing it to what benefits him. It might be something that somebody thought, oh, if I hold my breath and I don't cough, maybe that works. And at the same time, there is no direct benefit for someone unless it's a person who is more of an influencer who's spreading this to get more followers, subscribers, and users to follow him on social media platforms. But there are others that are more clearly out there, and it's important to follow the money. So the first one is business and multi-level marketing. And the reason I've highlighted multi-level marketing is because if you look at some of these aloe vera products, so if you look at Forever Living, for example, as a brand, and you look at some of the other brands that operate in that way, Trevo and the rest, they operate in a way of a pyramid scheme. And what this does is it increases and incentivizes their followers and their salespeople to just sell no matter what happens, irrespective of the claim they make. And the way they are in safe hands is because on their websites, they clearly mention that they don't support any of these findings, and what they've heard is basically just from users. But at the end of the day, those who are selling it, especially in developing countries, and I've seen this in Tanzania widely, is that those who share it, they share it with a mindset of make the biggest buck because it's a pyramid scheme. And so for them, it's the main thing is share it as much as you can, use any false lies, say it cures COVID, say it cures diabetes. So that is one issue. The other issue is those businesses who benefit from misinformation or the lack of evidence. So either if they are selling a miracle cure, or they are selling some other items that have been claimed to be beneficial in terms of treating or preventing COVID-19, there's always a monetary gain. The second group of misinformation comes from politicians, and this has a different level. The first is that they might be propagating myths because they don't fully understand it. So something that Donald Trump does, for example, with hydroxychloroquine. The second one is they do it to rally up their base and as it's a propaganda machine. So we know that China and Iran, for example, say that this virus was created in the United States. And this is a propaganda that's used for that country to rally up their followers. Similarly, the president of the United States talks about this being a China created not the president, but a lot of right-wing politicians. You say that China created this. One famous person goes by the name Dr. Siva, who's been quite famous on YouTube for spreading these lies, some of which have been spread in various groups I'm part of. And if you see, he's rallying up his base because he's running for Senate in the United States. And this is something to understand and keep in mind. I think all of us have to be cognizant that there is someone somewhere benefiting from misinformation, from the panic, and from the fear. And so political gain is another one. The third is a snake oil salesman, which I partly covered in the business and MLM part, which is just a normal salesperson who's ready to do anything to make a quick buck. The fourth is a YouTube influencer. In India, there's a famous YouTube channel that is actually known just to propagate misinformation. Of course, YouTube always trying to take down these things, and we'll discuss that more later. But you see that this person is propagating false information time and again because they are getting more followers. At the end of the day, if you have the science that is currently still evolving, and we know that there is no cure, I mean, the prevention method is to stay away from crowded places, keep physical distancing, wash your hands with soap and water. And then you have this person here who says, wait a minute, these scientists and researchers are saying, oh, they are still developing the cure and the vaccine. Well, guess what? I'm telling you, lime and ginger works. Why don't we go with that? So because of the lack in the knowledge that we have and the lack of evidence when it comes to COVID-19, it has kept a space for those who are propagating misinformation, conspiracies, and lies to take up the center stage, so to speak. And this is the other challenge, that first of all, it is a pandemic. It has affected everywhere in the world, something that hasn't happened with Ebola, for example. And at the same time, the second thing is that because of the lack of evidence, it has allowed others to take center stage, unfortunately. And the last is celebrities. And we cannot talk about how important this is. A lot of times celebrities do push up propaganda and a lot of this false information, and sometimes for political gain. So for example, Gwyneth Paltrow, a very famous celebrity, actually pushes her own brand of health and wellness products called Goop. And she has been debunked by various researchers and scientists that I work with for some of the things that for some of the things that she says and she sells. At the end of the day, Netflix gave her a new show, and she's currently propagating more misconceptions online. And so it is a tough thing to deal with, especially if you have celebrities talking about this. There are various celebrities such as Wiz Khalifa who actually propagate that coronavirus spreads through 5G. At the same time, if you look at misinformation in general, and some of you might find this funny. So if you remember the actor who played Thanos in the Avengers, that guy actually tried perineum sunning. It is basically this wellness trend that started where you sunbathe areas which are not supposed to be sunbathed, if you get what I mean. And he actually got burnt in those areas and ended up on the news because of that. And it shows you that everyone is susceptible to misinformation. And even those who are celebrities are susceptible to it. And then some of these celebrities actually propagate it because they have some sort of benefit or gain, or maybe it fits their worldview. So it's important to understand that this is on many levels that we are fighting. It's not just, somebody just sharing it and saying, oh, this is this. Oh yeah, auntie shared this misinformation, it's very bad. Well, there are those who are propagating it and gaining from it. We have to deal with it from both levels. Now, I've discussed some of the types of misinformation. I will just touch on some of them more. The miracle cures and treatment is a big area. So this we have seen blow up during COVID-19, all the way from miracle cures and herbs like garlic, bleach, using the MMW, which is a miracle mineral water, which was famous in the United States. It's basically just a brand of bleach which was being spread by this sort of cult to treat COVID-19. So this is one group of misinformation that we have seen. And at the end of this presentation or talk, I'm ready to debunk some of them if it's needed. I'm pretty sure everyone watching this understands the truth and the myth, but I'm ready to do that, especially if we can coordinate what specific myths needed to be debunked. And then the second is false preventive measures, such as if you stand outside the sun, then you won't get COVID-19. UV light may prevent the COVID-19 from sticking onto your skin surfaces. So these type of myths are for the preventive side. You have the testing for the breath test we discussed, and then you have a lot of pseudoscience. And this is something to understand, that some of this misinformation comes from somebody misunderstanding or construing or bending the science. Now, We have seen this in our cancer and misinformation studies as well. So for example, I'll give you an example when it comes to COVID-19. Currently, there's research and studies being done to see whether UV light can be used to disinfect N95 and surgical masks as a way of reusing them because there's a supply shortage globally. Now, if you look at the N95 and the surgical masks specifically, you will see that the research is being done whether we can use it. If you look at UV light in general, we know that UVA and UVB does not does not kill viruses or bacteria as such. We know that UVC is known as a germicide and currently being studied for disinfecting these masks. Now, somebody hears that, and what they do is they construe that fact and say, oh, if you stand in UV light, COVID will die. Or if you stay in UV light every day, COVID will never come to you or never stick to you, because before it infects you, it will die. So there is that misinformation. Similarly, we know of a famous politician who mentioned that steam inhalation of over 100 degrees centigrade, I mean, if you inhale that steam, it will kill COVID-19, which is again false. Again, so that takes a concept of autoclaving procedures and how steam at high degrees does kill viruses. And this is something being studied right now over here in Calgary, that whether autoclaving can help kill the viruses when it comes to N95 and surgical masks, but it has no benefit when it comes to inside the body. So a lot of this misinformation, even the bleach, is when people take the science that works on disinfectants and surfaces and say, well, if it works on a table, why wouldn't it work on the body? So it's basically pseudoscience. It's taking something that is true and then bending it and turning into something that is actually false and doesn't exist. And this is something we have seen across the board. There was a UV business going on here, especially in the West, called UV Room, where you're put in a room, they shine these UV lights to you, and apparently it can cure cancer. And there are some people who left chemotherapy to actually join this. And if you look at it in its entirety, we know that UV light is a carcinogen, is a non-carcinogen. We know that it can cause skin cancers, among many others. And but this business was going on, and they were doing it as a way of curing, or as for wellness. At the end of the day, on their website, they cited an animal study. So these days, misinformation may not always be just outright blindly crazy type. Some of them are not outrageous, but they are sort of using some accurate information and then spreading it with inaccurate information. Some of you may have received the famous message that says certain viruses cannot live in certain pHs, and then it talks about different fruits that have a high pH that you can eat. So you see, again, it's always a mixing of information. I mean, apparently, this has been effective in spreading misinformation around. And I think we also have to understand from what angle people are coming from. So when you talk about miracle cures such as garlic, don't we know that grandma used to say, eat honey, it will help you with a sore throat? Don't we know that we have these sort of herbal or cultural cures that are there? So is it outrageous then for somebody to make that connection and say, well, if it cures a sore throat, and if coughing is one of the signs of COVID-19, probably garlic and honey will help. So that's the theory. Of course, it is false. There is no evidence behind any of this. But at the end of the day, I think we have to be empathetic, and this is something that I'll talk about later, to understand from what angle does someone come from. Now, the other is the hoax and the bioweapon type of misinformation, and some of this has been famously peppered around in the Plandemic movie that some of you may have watched, which is full of misinformation. And that is a bit outrageous and out there to say that this was engineered, to say that this is a hoax, to say that this doesn't exist. It's just a way for the government to control the minds of the people. And you'd be surprised at how many people actually believe in this. Our current study is actually looking at the spread of hoax misinformation on Instagram. And so we'll be probably publishing this paper in the coming months as well. Now we've talked about that, it's important to look at who is vulnerable to misinformation. Not everyone is equally vulnerable, those people who have a distrust for the government and a distrust for authority and sort of public agencies do have more susceptibility of being vulnerable to misinformation because they already harbor that government distrust. Those who believe in other conspiracies. So for example, we have noticed that those who believe that the earth is not round, that the earth is flat, that is a conspiracy. There's a whole group of conspiracy theorists who believe in that. We have found that they actually believe more that COVID-19 is a hoax. So if you believe in one conspiracy theory, you're more likely to believe in another. Similarly, we all know many people who believe that 911 was an inside job. And again, those who believe in that as well were found to believe that COVID-19 is a hoax. Now, it's not necessary that if you believe in this, you must believe that, but it sort of increases your susceptibility of believing in other conspiracy theories. And third is those who have had a bad experience in general with the healthcare system or with public authorities or with the government. So if somebody had a child who was given a vaccine or was given a medication and there was a very adverse side effect and this has personally impacted them, then you will see that they are more vulnerable to accepting things like, oh, the healthcare system doesn't care, things like that. So I think we have to understand at the end of the day that it's important to look at which group in society are more susceptible. Of course, those who are less literate are also more susceptible because they have not studied the evidence, and also they don't have the ability to look at the evidence and say, is it going okay or not? And is this correct or true or not at the same time? Now, I'll discuss some of these points that may help some of you who are health professionals and are ready to address misinformation, as well as those who are not health professionals and want to sort of join in. It's very important to push back against misinformation. There was a research article published recently that found that pushing back on misinformation has benefits. There was another study that looked at Twitter and Facebook misinformation, and they found anybody commenting on it and commenting the truth on a false fact actually helps dilute the credibility and the integrity of the false and the lie. So I think that's something else we have to keep in mind. So there is a benefit in this and there's science for that. I'm talking about so many researches, I know. This presentation wasn't meant to highlight that. I'm ready to share it with anyone who needs this research. I can share with you the links and the summary as well, the abstract for these. Okay, so now how do you address misinformation? What I've written here is how health professionals and the public can address misinformation. But there's other things as well that I would like to touch upon. The first is that social media platforms can address misinformation. Some of them have tried, although I think they can do much more. So today, Twitter has launched a news platform in terms of how they're going to try and curb misinformation. They've even said that even if misinformation is spread by political leaders, they will take it down. Anything that is against the current recommendations of public health agencies and the World Health Organization. So that is great. If you search for COVID-19 or coronavirus on Instagram, you will see the first thing that pops up is it tells you that, do you want to go and get accurate information from WHO? And then you can decide to say, yes, you want to go to WHO, or no, you want to continue seeing the posts. So that is another good thing. YouTube keeps taking down videos that spread misinformation. And this is something they've been working on for a while now. So these are all ways that social media can work, but I think they can do far, far better. Elon Musk, for example, posted that we need to open up and things about how the lockdown or sort of the physical distancing measures are not needed. And I think this is something that needs to be addressed as well. So there are people who fall through the cracks, probably having a button where you can click and say, this is false information, so that you can ping the Twitter curators. I think some of these initiatives are needed. So social media has done something, but they are far from doing what they can actually. The second is when it comes to medical journals. Some of these misinformation start because of research that was published that was faulty. The French study, for example, that was conducted on hydroxychloroquine was not accurate and had several flaws. In fact, the publishers mentioned that study had several flaws in it. And various other studies conducted after that, those in China and the United States, have found that hydroxychloroquine does not have a significant benefit. Now, this is an area of study, of course, and clinical trials are needed, especially high quality randomized double-blinded clinical trials are are needed to compare whether hydroxychloroquine and a placebo, whether there's any effect, and then whether hydroxychloroquine and remdesivir, which is the second runner-up to right now, has any benefit. So at the same time, but medical journals are rushing to publish articles related to COVID-19, and this is dangerous. I think it is an onus on reviewers as well as editors of journals to make sure what they publish is accurate. At the end of the day, if you publish something that is inaccurate and then it gets spread on the media, and then later when you come back and say, oh, this was inaccurate, we withdraw it, it's too late. It has already reached all parts of the world and the misinformation is already spread. So the second part, apart from social media, is the onus and the responsibility of medical journals. The third, of course, is having leaders and influencers, politicians, celebrities who are more cognizant of the science and who are ready to take on board various evidence-based research to make policy decisions and announcements. And the fourth is us. Many of you have joined this show, our healthcare professionals. So it's based upon us, and I think it's our responsibility to address misinformation. And now this is how you do it. The first important point is to have empathy. At the end of the day, you have to understand from what perspective somebody comes from. Why are they saying something? What is their whole point of saying this? What is the background they're coming from? So again, like if you understand that somebody is culturally believing in some herbal medications, then explain to them that while some of these fruits, vegetables, herbs may have symptomatic relief, and there is studies that show, for example, taking honey soothes sore throat. So there are some that have symptomatic relief, but at the end of the day, we know that they do not cure or treat any disease. Second is to establish yourself and your credibility. At the end of the day, if every person just talks about something, there is no benefit. You have to establish yourself as a credibility, who you are, where do you work, what field you are in, and whether you are well positioned to talk about what you want to debunk or address in terms of misinformation. Third is reliable sources. Of course, you need to reference what you say from reliable sources, so that improves credibility. At the same time, by mentioning what is the source of your information, you increase the credibility of your information against that of misinformation. Fourth is my concept of making public health viral, and this is something that I've been talking a lot. And recently there was an article that came out in Nature that found out exactly this, that one way to combat misinformation is by flooding social media with accurate information, with accurate, highly engaging information. If you see misinformation, it's generally very simple. And so when you have a very simple misinformation that says 5G transmits COVID-19, and then you have this scientific response that comes behind it, you have tuned out a whole crowd. You have tuned out this whole demographic that were not able to understand your message, but they surely understood that message. So I think it's important to take research and translate it into knowledge that is bite-sized, that is easily understood, and that is highly engaging, something that people will like to share. This is something that I've been trying to do. This is something that the MHI team has been doing pretty well. Some of those posts that say meet Ali or meet Hassan or something like that, and they have a picture of somebody with a quote or what is the truth. I think that has been done very well, and congrats to the team that is working on that. That is exactly one way of combating misinformation, by creating highly engaging, easily understood, accurate information. The other is to reiterate things. So for example, if you have a health professional that is spreading something that's accurate, to reshare it or repost it and reiterate it actually is a good method of spreading accurate information. It makes things go around and spread faster. The other thing you have to keep in mind is your target audience, who you are targeting. And when we come to addressing misinformation, and please keep this in mind, we are targeting those who are in the middle. We are not targeting the extreme people with the views. There's a few or some of the people in society who believe in conspiracy theories, who don't see the evidence, who will not be convinced to see otherwise or to see evidence. But what we are aiming is in this group that is in between, these people that have been misinformed, these people that don't know what's right, these people that don't know what's the truth. So that's who we are targeting. The other thing is we have to be surgical. So sometimes some of the information that I give out is pitted against information that was delivered by a politician or information that was delivered by an influencer. And how would you tackle a situation like that? Stick to the science, be surgical. Be surgical in your criticism, be surgical in your response. At the end of the day, we don't need more fluff. You need to be very accurate and pinpoint to what you're saying. So somebody says, let's say steam inhalation can cure COVID-19. Your response would be the clinical evidence doesn't prove this, while steam inhalation can prevent nasal decongestion if done correctly to a certain extent. It can also cause various side effects, and it can also cause respiratory failure and exacerbate COVID-19. Simple as that, you have reached the point. Don't get into the fluff of saying, oh, this person or that person. It doesn't matter who the person is. It matters what the message is and how you are correctly and pinpoint accurately countering the misinformation. So that is something that I've learned. That is something that always works best, whatever you do. The other is stick to the science. Now, you'll see there's conflicting research. So for example, let's talk about one of the famous things that there's misinformation within health professionals, vitamin C. What role does vitamin C play in immunity? Now, if you look at the research, and even if you look at, for example, 5G research, there is preliminary studies that show 5G may have a side effect on a cellular level when lab tests are conducted, but there is nothing to look at it from the epidemiological perspective if you look at it from the population point of view. Now, you will always have people countering with you and saying, oh, this study say this, that study say this. Now, first of all, not all studies are the same. Studies have studies with small sample size, studies with changed outcomes, studies that have various other inaccuracies such as biases, conflict of interest on who is funding it. So you cannot say, oh, just because a scientific or research study say this, then this is true. Not at all. So one way, and this is, and if some of the people don't have the actual knowledge and the literacy to actually look at studies and go through all the time to do that, one way to look at is to look at systematic reviews, because systematic reviews are one of the highest qualities of evidence we have. Now, it doesn't mean that that's the best and it's always accurate, but systematic reviews are generally the highest quality of evidence because they combine all the clinical trials, all the individual studies, they put them together, they appraise the quality of the studies to see which studies has high quality, which has low quality, and then they take the high quality studies and sort of make a recommendation in a summary. So when people talk about vitamin C and immunity, there is no evidence that taking vitamin C actually prevents a cold. Similarly, there is no evidence that vitamin C has any effect in your immunity in general, especially when it comes to preventing COVID-19 or viral infections. Now, that information, in terms of it not having a benefit in treating the colds, is from the Cochrane Library. And the Cochrane Library is known to produce some very high quality systematic reviews. At the same time, they do mention that they found some small benefit with vitamin C when it comes to athletes. And specifically only for athletes, some studies have shown that there is benefits and they've appraised that. But there is no benefit when it comes to the general public. And then they do mention that there is no benefits at the end of the day for vitamin C. So I think you have to be cognizant of that fact that it's not a study versus a study. Look at the high quality study and deal with it that way. Finally, it's epistemic trespassing. This is when an expert in one field transfers to another field. So when I was looking at whether the virus was created by humans, when I was studying that, I was looking at the fact that what is it at the cellular level, at the biotechnological perspective. I did refer to Muhammad Zahir, who is an expert in that space, and I looked at what research he shared with me and what is the research on that area, and then I shared that accordingly. Whenever I'm told to speak about statistics, for example, of COVID-19 on various news outlets, I refuse because that's not my area of study. At the same time, I don't work in modeling of COVID-19, so I will not comment on those areas. So epistemic trespassing is when an expert in one field goes and transfers to another field. So for example, Dr. Siva, the one who's spreading misinformation in the US, he's an engineer, but he's spreading misinformation in terms of of health, which is something he's not an expert of. Similarly, if you're not a pediatrician, well, then don't talk about that. If you're not an emergency physician, then don't talk about that. We should all stick to our own fields and areas where we are more comfortable with, and be ready to refer others. So epistemic trespassing is another way that misinformation spreads, and we have to make sure we don't do that when we are addressing misinformation. You can always share something that an expert in that field has said, but you don't necessarily have to say it. Now, you'll get pushback when it comes to dealing with COVID-19. You have to have a thick skin. So I'll just give a small example. One of my news outlet videos was shared on a YouTube page that was anti-government. I got a lot of pushback, a lot of abusive language and things like this, which is pretty normal for those of us who work in the debunking space. There are scientists who I work with who receive almost 100 hate mails per day. How to deal with it? Have a thick skin, be empathetic, try to understand that you have actually blown up or broken this person's core beliefs. They have cultural beliefs, they have these beliefs that their families told them, they have these concepts and notions they've had for years. You've just told them it's not true. Keep that in mind, be empathetic, and also engage in dialogue. So I'll give a small example of what happened with me in BBC Swahili. One of the people told me, you're saying that lime and ginger doesn't help. You are wrong. I explained to him what's the truth. He said, oh, I'm sorry, I didn't know that. I actually thought this would be beneficial. I bought 2 bags of this. So at the end of the day, this person had already bought this, and that's why they were feeling a little upset when I was telling them what the truth is. At the end of the day, they did thank me for telling them the truth, and they said they'll inform their relatives not to buy it. So at the same time, so sometimes pushback is a way people say, reaching out and saying, no, I don't believe this, but you need to reach back and say, wait a minute, let us discuss this. Yeah, so I think I am on time with the talk, and yeah, I'm ready to take in any questions that may be there, and we can discuss some of the myths further if anyone wants that.
Thank you very much, Dr. Sajjad. This was a fantastic talk, and I think the main message as to why misinformation is being spread and how we can actually curb that was very well taken. Perhaps to start off with the question and answer session, maybe if you allow me, I would like to be the first. My question should be the first one is regards to actually what you mentioned on steam inhalation. So we know of politicians who are very adamant in terms of what they believe in with respect to traditional medication, with respect to herbal medicine, with respect to steam inhalation. And when such politicians formulate their policies and formulate how they are going to govern their constituencies or their regions, or even the country for that matter, based on those policies, what can we, the laymen, the normal people, the citizens, what can we do to address that?
Yeah, and that's an interesting question, because it's challenging. It depends where you are in the world. So if you are in countries that are run by authoritarian regimes and dictatorial regimes, if you look at China, for example, it's quite difficult to address such type of misinformation over there. I do think it's important to have freedom of expression, but that's not possible everywhere. I think as a citizen, at least at the bare minimum, at the local level, you can at least address misinformation within your own circle of friends, within your own circle of relatives. You see, many a times when you see somebody sharing misinformation, and you know that this is misinformation, you would decide that, no, probably I shouldn't get into it. I don't want to debate, I don't want to spoil relationship with this person. I don't want to do this, but you don't know how many more people this person is sharing it with or spreading it to. So I think at a very minute level, it's important to say that this is inaccurate, and then provide something that's accurate from a public health authority. So the World Health Organization, the Public Health Agency of Canada, the CDC, provide what's accurate with the link over there and send it to them, and then let them have a look at it. You don't have to get into that debate necessarily. You can say that, this is misinformation. I found that this is the accurate information. Share it over there, and then you have done your duty, at least on a local level, as a personal, with your personal relationships. I think that's important. At the same time, you also make sure that you don't share things, you delete it immediately, and you don't just spread things around. Don't think, how will this benefit someone? Think, is this accurate?
Thank you so much for that answer. I see Shania Bas Jafar. Karibu.
Yes, so to begin with, Asante Sana, thank you for the informative section, Doctor. The question I have is regarding other sources of misinformation. Now, I would even be careful to use the word misinformation for such terms because we actually don't know a lot about this, and especially these relate to religious cures. In the sense that, for example, you might have come across the cure of Sena Makki. It's many of the Muslims promote, and I don't know if there's even a way to verify whether these traditions actually are accurate, and if we are even of the caliber of verifying these things, and what would you have to say in general about religious related cures and religious related misinformation?
Yeah, it's interesting. Tough question. I think at the end of the day, we have to reiterate what has been evidenced by science. Now, and I will relate this question to those who talk about herbal cures, okay? So cultural and religious statements. If you look at these two together, what I have found out is that, you see, and this is when I discuss, I take it from this perspective. We know that there are some patients who have lack of sleep, who drink chamomile tea and say that it helps them sleep because it gives them a soothing sort of feeling. So if somebody tells me that, yeah, sure, go ahead, have your chamomile tea. I mean, there is no exact evidence that there's a mechanism, but sure, go ahead. If you want to drink chicken soup because you think it's beneficial, yeah, it's a nutritious thing, that's fine. If you want to eat garlic, yeah, that's fine, eat it. But if you're saying that garlic or chicken soup or some of these cures are some of these things actually cure or treat a disease or condition, that's where we have a problem. I don't mind somebody saying, oh, I want to drink orange juice because I feel good or something. Yeah, sure, go ahead, drink as much orange juice as you want. But then when it comes to saying that, oh, orange juice actually cures COVID-19, that's when I have a problem. So I think it's important to draw the line. Not every nitty-gritty detail or nitty-picky thing we need to go against. At the end of the day, when it comes to herbal medication, and this is my perspective, and that is held by many other researchers, including specialists of herbal medication, so pharmacognosists as well, is that if you look at somebody who wants to use herbal medication, if they are truly aware that this is just for symptomatic relief, and that that their medication, this herbal medication or these other cures, does not interfere with modern medicine, there's no interactions anyhow, then it's okay to them. Yeah, this will provide you symptomatic relief. You want to go ahead, sure, but make sure you follow these evidence-based advices that will actually help, that will actually be a cure or prevention. So I think having that difference and that distinction is important on how we advise people. At the end of the day, you can't tell everyone that. You have to keep in mind culture and religion. And I'm not saying that you should agree to things that are not backed by evidence, but at the same time, look at to what extent they're engaging in that behavior. Are they saying it cures, or are they saying, oh, this is something that I'm going to do? Yeah, sure, go ahead with that, but also keep these evidence-based measures in mind.
Thank you very much. Our next question is from Hiten Solanki. He asks, in the case of a population already influenced by conspiracy theories, will presenting facts from public health sources really help?
Yeah, great question. And yes, it does help. So there is research and evidence and data to back this up, that if you do spread accurate information, you're diluting the integrity of the false information and conspiracy theories. Now, keep in mind, when you say a population influenced by conspiracy theories, that's a huge spectrum, right? There are those who might think or be doubtful or skeptical on whether the conspiracy theory is true. On the other spectrum, you have those that are staunch believers of the misinformation, and in between you have people who think, oh, maybe this is true, maybe this isn't true, I'm not sure, and who think that probably this is correct. So you are aiming for those who are unsure whether the misinformation is true. They're more likely to believe in accurate information, and you are aiming for this middle group that is unsure. You will obviously be spreading public health sources and accurate information to everyone, but you will not convince those those that are sort of staunch believers in this, those that are propagating this, those that it fits their worldview so well, that there's a big cabal running the whole world trying to make all of us a slave, So you will not be able to convince them. But at the end of the day, this majority that's in the middle, you will be able to convince. So I think that is something to keep in mind. And yes, it's definitely something, if you can at your own personal level or even regional level, to continue, or at a community level.
Asante sana. Any more questions from anybody? You can raise your hand or feel free to unmute yourself and ask the question, or simply type in the group chat. Seems like, Dr. Sajjad, your talk was very clear to people, not many questions.
I think it's a topic that well, we've been discussing in various groups for a while, and at the end of the day, I mean, there's a lot of organizations and health professionals, even MHI itself, that have done a great job in debunking myths. So, and it's a good thing that, I mean, it just shows that whoever has attended understands that these are myths and these are facts, but probably what they didn't understand, how it spreads, who benefits, and how things go ahead.
We have a question from Urujul Hassan, who says, what sources of information should we trust?
Yeah, that's a good question. So you would go for public health authorities, public health agencies. You would go for organizations such as the World Health Organization, the CDC, and you would stick to those credible institutions. I wouldn't say you would go to cite one research, because the research is still evolving. And as we know, hydroxychloroquine, it's still out there. Most of the research says that there is no benefit. Some say there is some benefit, though those are poor quality studies. If you look at vitamin C, you'll see studies on both sides. So again, you have to be able to appraise the studies, which is why I wouldn't say share a study, because it'll be just like a study versus study versus study. It doesn't give any accurate information. Why did I mention these sources and these agencies? Because they actually curate all this evidence, and then they come up with a policy, and then they come up with a recommendation. They don't just take one study. And I always say, one study, a policy does not make. It is a collection of studies, a collection of recommendations that actually you see what's going on, and then you address it. And this is something that we saw that has been happening with masks. At the beginning, they were saying, oh, masks doesn't, there's no need for the population to wear masks because it doesn't have a benefit. Till today, the science says there's no benefit in terms of, for cloth masks, I'm talking. It doesn't filter viruses, but it will help stop the spread of droplets from somebody who's infected and asymptomatic. So at the end of the day, as the research evolved, so did the recommendations and policies. And that is not a sign, contrary to some belief, that is not a sign of the science not being true, or we don't know what we're doing, or we're just walking in the dark. Yes, there's a lot we don't know about the virus. There's a lot we are actually learning about the virus. Public health and health professionals in the world are just doing their best. There's no clear guidelines for example, treatment necessarily. When it comes to prevention, we know what we know so far. But as things develop, and if you see policies changing, it doesn't mean that things were wrong. It also means that it is development, and people are open to taking feedback, and we are developing with the science. So it's a positive outlook. It's not something to look at negatively.
Okay, so for the next one, maybe I'll just ask a question to get your opinion. So as we know, many of us stay in countries where the political motives, the political scenario is different, and does not promote really criticism of the main agenda that is promoted by the authorities. So in such a situation, what would you say is the role of the people living within to debunk or try and spread the right information? Should they be cautious? What should they do in general in such scenarios?
Yeah, good question. So 3 things. One is you can rebuttal the official you can rebuttal the narrative that is misinformation without mentioning the person, without mentioning the political party, without mentioning the country, just by saying that this was the misinformation, this is the truth. It's something that I've been doing pretty successfully, and that has worked for many others who have been following those footsteps. So don't mention the person, don't criticize the authority or something like that necessarily. Especially if you live in those type of situation, criticize and sort of don't criticize but rebuttal the misinformation with facts. The second thing you can do is within your own community, local and personal level, to spread accurate information. And three is to continue spreading accurate, highly engaging information within your networks, even widely. Because at the end of the day, one of the clear ways, and this was written in Nature, that we can combat misinformation, and this is something that a study I'm working on, which will be publishing hopefully sometime in the summer, which what we have seen is that one way to address misinformation is to spread highly accurate, engaging information. So you can do that without getting into a mess or into a trouble, because you're not going against what's the sort of official narrative. And probably
Dr.
just to add in, what you can also do is that you can always reiterate what other public health authorities, public health professionals, and agencies have said. So at the end of the day, if you do share, let's say, what the World Health Organization said, it's not necessarily coming from you per se, but it's coming from an organization that is well reputed. So that's another way to go about it.
Thank you for that. Dr. Sajjad, so in our community, if I was to generalize it, sort of, so to speak, for just our communities, Asian communities, what we are seeing is an increasing trend in particularly middle-aged people, so male and female both, who are somewhat very, especially in this last couple of months, whereby the coronavirus impact has really taken a toll, they become the phone warriors. So message received, forwarded as received. This is something that goes on around and around. We see middle-aged people who are very, active, because they are at home, their businesses are not really running. They have a lot of time probably in their hands. And so they go on forwarding messages that they have absolutely no clue about, or maybe they do, but then they just don't understand the impact that they have created in terms of sharing it in groups of 200 to 300 people, which exists quite predominantly in Tanzania. Now, how do we, as a community or as the MHI, so this is something we've been thinking about, but how do we actually tackle the mentality of such people, and how do we educate them not to forward as received, those messages, and first verify them, because this is something I think that is deep rooted into how one thinks and functions. What would be your take on that? So,
good question. Maybe I just need a little more information. As a community, the leadership, have they addressed this concern so far?
I'm not sure if I can hear you. Okay, yeah, now I can.
Have the leadership of the community addressed this concern so far?
No. So the issues related to such misinformation, or basically just this mindset of sharing information or forwarding information as received, may or may not necessarily reflect on community matters, so to speak, or religious matters, so to speak. It could be information at large, and the information does not necessarily have to be COVID related or religious related or Jamaat related. And therefore, it is difficult for the community leadership to sort of step in and say, well, you are not allowed to do this or you are allowed to do that, unless I misunderstood your question.
Yeah, so at the end of the day, and no, I got your question. So I was looking at it from different perspectives, right? It's always good to take a multi-pronged approach to things. So if you look at when there's misinformation spread within a community, would be nice, would be ideal to have the leadership of that community to address that this is something that's going on, and we advise this. It's not about don't do or do this. At the end of the day, it's a free country, but just to highlight the importance of not spreading misinformation, how it affects people, and why it's important to verify. Yes, I've seen this going around, that forward as received, as if it sort of gets you rid of the responsibility to fact check and verify. A very horrible thing going on. But I think so. One thing is to have some sort of leadership or some sort of health professionals as well. Give out a message, put out a statement, and share that around widely, that this type of thing has a harmful effect. Probably if you can get and see who was actually harmed within the community, not necessarily mentioning people, but saying, oh, there are people who got misinformation that steam inhalation is helpful. They started doing steam inhalation. When they came to the emergency room or in some of the health centers, we found that they had this sort of prognosis, and they had this type of thing. Without breaking patient confidentiality, of course. But since it's a community matter, I think it can be something that can be looked at. It is from a general perspective of having that messaging. At the same time, the second thing I think is, as health professionals, and just advising the public and creating this culture of not forwarding as received by pushing back against it. By pushing back against forward as received, by saying, did you fact check this? Did you look at this is accurate? I got a message just last week. Somebody sent me a message which says that the government created the virus. And this person actually wrote to me on Facebook and says, why don't you make this into a small WhatsApp video and share it around? And I found it quite funny. But at the end of the day, I was like, no, this is inaccurate. You want to know what's accurate? Here it is. And they're like, oh, okay, then why is this person saying that? We didn't do that debate. And sort of then at the end of the day, they understood what was the truth, and they stopped sharing what they were sharing. So I think having pushback, having a concentrated effort, maybe as MHI, to push back. So apart from the great job you're doing in terms of spreading accurate information, which is very effective, it's also good to push back against misinformation. So maybe have health professionals among MHI push back. And how would they push back? Instead of having everyone create a narrative, probably the team that works on creating these great infographics, they can create an infographic about pushing back about maybe some of these side effects of misinformation, and sort of having this whole culture. At the end of the day, Mohammed said, what you have touched upon is important, and you have discussed about the culture of sharing and forwarding as received, the culture and the mindset of who is this going to benefit, in terms of saying, instead of saying this, is this accurate, is this true? So I think we have to change the cultural shift. It's not a quick shift, it's not a quick and easy fix, but it takes a concentrated effort from leadership, which is a top-down approach, and from the bottom-up approach, which is health professionals and just people who are more literate, pushing back against it, saying, wait a minute, this is not okay, and doing it in a very compassionate and empathetic manner. It's not about saying, oh, Bapa, it doesn't work, what are you doing? You're spreading misinformation. You cannot go that route. You have to take a very empathetic and a compassionate route. At the end of the day, most of these people aren't benefiting or profiting from this. They're not the propagators, they're the sharers. And I think taking it in that way and sort of explaining, and yeah, today you might say something is not accurate, somebody might not believe you, tomorrow you might do it, the day after, it comes slowly over time, because it's a cultural shift.
Right. Thank you so much for that elaborate answer. So before we wrap up, does anybody else have any question, comments to Dr. Sajjad before we end this? Okay, if not, thank you very, very much, Dr. Sajjad, for your very informative talk, and for your time and efforts to guide the community and the general audience on various misinformation routes and how they are caused, and what we can do as a society to actually curb that. So thank you very much for that. For the viewers, stay tuned for our next seminar, which will be announced soon. And the MHI is happy to take on the seminar sessions as we go on. Thank you very much for everybody for joining, and have a nice evening.